nearly 11 a.m. here in Seoul. I'm Oh Soo-young at the Arirang News Centre. We'll break into our regular programming to bring you a live briefing from the South Korean health authorities on the coronavirus outbreak here in the nation. In just a few moments, we'll cut into the briefing at the Sejong Government Complex with simultaneous interpretation available for you in English. Director of Health Policy Yoon Tae-ho will be briefing us on the coronavirus situation here in South Korea, filling us in on the number of new infection cases seen as of midnight and what kind of efforts the government is making to contain the virus, especially with a spurt of cluster infection cases in the capital area of Seoul. And it looks like the briefing's just about to begin as Director Yoon has taken to the podium.
First of all, here is Mr. Yoon Tae-ho with the explanation on the COVID-19 situation. Let us now begin our regular briefing for August 26th, Wednesday. As of today midnight, we have a total of 307 new local infections. Among them, in the metropolitan area, there are 229 cases being confirmed today, accounting for about three-fourths of the entire caseload today. And we also see an increased number of cases in other regions as well, with 78 across the nation so far. And in Wednesday, we also have, last week we have issued the social distancing measures and level 2, and we also did an analysis of our mobile traffic, and we have seen in the metropolitan area compared to the previous week, we have seen a 20% decline in the amount of mobile traffic. We would like to extend our deepest appreciation to all of the public for your participation, and in the large cluster and massive outbreak that took place in Daegu, we also seen that there was a 40% decline in the mobile traffic back then in Daegu, and we believe that we need to ask the public to continuously exert their full efforts to achieve a social distancing level 2. We have said multiple times that this week is a critical moment to determine the future fate of our outbreak, and we ask for your continued participation in the social distancing measures. This morning, Prime Minister Chung Se-kyun presided over the headquarters meeting, and he discussed issues including the expansion of the life treatment centers throughout the country. And he also said that all collective actions that put at risk the lives of the patients will not be tolerated by the public, and he asked all of the medical doctors who are taking the collective actions to resume back to their duties in accordance with the resumption of a medical services order issued by the government. And here are our measures to expand the number of hospital beds. And lately we have seen that over the age of 60s, and the cases over the age of 60s account for about 40% in the metropolitan area. And we have seen a large increase of the number of patients with severe or critical conditions, which only hovered around 10. However, it has now increased to 43 today. And therefore, we see a possible lack and insufficient number of hospital beds here in the area. And we also have established a joint scheme so that we have a joint situation room to look over the number of hospital beds in the metropolitan area, including cities of Seoul, Incheon, and Gyeonggi-do province. And depending on the severity of the symptoms, these patients are sent to the life treatment center as for these patients with light symptoms. And in the metropolitan area, we have 319 hospital beds for the critical units, and we have about 19 available right now. And as for the infectious disease designated hospitals, we have about 1,050 of them available. However, we only have about 23 available in the Gyeonggi-do province. And as for the life treatment centers, we have a total of 1,743 beds available, and about 600 of them are available for use right now. However, we believe that we see a lack of the number of ICU units, hospital beds. And many of the medical practitioners are exerting their concerns, expressing their concerns of a possible lack, and we will also continuously to secure more beds going forward. And based on the presumption that we will have about 300 patients on a daily basis, we believe that until September, we would have up to 130 patients with critical or severe conditions. And in Seoul City, we will secure additional 36 hospital beds for these critical patients. And we will also adjust the number of the other hospital beds that are used by people with lighter symptoms. And we will also increase our capacity going forward. And together with the compensations for the losses, we will provide incentives for all of the hospitals, as well as large university hospitals in the metropolitan area. We ask for your continued cooperation. Meanwhile, until September 15th, we believe that we will need about 1,700 hospital beds going forward. And considering the hospital beds that are in utilization right now, we need an additional 700 more hospital beds for the infectious disease designated hospitals. And we will also secure additionally 780 hospital beds going forward across the regions. And as for the 5th of September, we need to increase the number of life treatment centers as well. And we need to also increase our capacity to house over 2,100 patients. And we will also increase the capacity to and open new facilities up to 4 with the cooperation with the Safety Ministry. And we will also secure 3 more going forward so that we can house about 4,000 patients going forward. And in relation to the collective medical walkout of the medical doctors, we have a few words. The government has so far taken in great candid discussions with the Korea Medical Association, as well as the Korea Intern and Resident Association. We have been opening all of our options, and we have also suggested candid talks. And especially amid the grave situations of COVID-19, we asked continuously for the association's continued support. However, the association has stated multiple times that they have also continuously urged us to scrap the medical reform plan, and the government also expressed willingness to sit down with the medical circles as well. And on the August 24th, we also had a dialogue with the health minister together with the medical association, and we asked the medical doctors to cease their collective actions until we have a stabilization of the COVID-19 situation. And after the situation is stabilized, let us engage in candid discussions. And we will also never unilaterally exert our policies, and we will establish a consultative body to reach a compromise with the medical association. Back then, the medical association asked us to give them some time to reach an agreement and consensus. However, they defied their decision, and they said that they will go on a strike. And they also withdrew from their agreement and compromise, and also carried out the scheduled walkout. And the government, considering the grave situations of the COVID-19 situation, we asked multiple times to engage in candid dialogue. However, the association has continuously and repeatedly called for the government to scrap our plans for medical reforms completely. Moreover, these collective actions are putting at risk the lives and the safety of our public. And we also would like to urge the Korea Medical Association and the Korean Intern and Resident Association to return to their duties, and we express our great pity over such scheduled walkout, and we apologize to the public that these situations are unfolding. unfolding right now. And as of 8 a.m. this morning, the government has issued an order to resume medical services immediately in the metropolitan area. In the metropolitan area, these include ER and also ICUs, and we also we will also monitor the situation of the resumption of medical services, and they include in the metropolitan area dialysis as well as birth delivery rooms as well as surgery rooms, and these orders will be expanded to the other regions as well, and if they breach these measures, they will be subject to an imprisonment of up to 3 years and about 30 million Korean won of a penalty. And we ask the members of the medical circles to exert their full duty to safeguard the lives and the safety of our public. And the government will also be based on the legal consequences and the legal principles in dealing with the scheduled walkout. And we would like to alleviate unnecessary tensions as for these continuous dialogue. And we once again urge the medical circles to refrain from taking their walkout and return to their duties. The government will exert our full efforts to engage in candid dialogue with the medical practitioners. We will exert our full efforts to protect the lives and the safety of our public. Today and tomorrow, we are forecasting strong wind and rain due to the tropical typhoon Bavi that is reaching South Korea, and thus we will be withdrawing the tent-style screening centers that are stationed across the country, and we ask the members of the public to refrain from engaging in outdoor activities and stay home if they and refrain from making non-essential travels. And we believe that we will have an increase of indoor activities due to the Bavi typhoon, and please wear your face masks when you are at indoors. The government considers these situations very gravely, and we will exert our full efforts to contain the virus. However, without your help from the public, we cannot overcome the COVID-19 situation. Up until now, we have been exerting our full efforts to battle against the virus. Let us renew our resolves again and also continuously cooperate. Thank you very much.
That was Director General of Health Policy Yoon Tae-ho telling us about the latest infection cases here in South Korea. He just told us that there were 320 new cases of COVID-19 in South Korea, bringing the total accumulated number to 18,625. There are also 2 additional deaths, bringing the total death toll to 312. Well, that wraps up our coverage of this morning's briefing. We'll be back with our regular newscast at noon Korea time. Bye for now.